So some of the misconceptions that families have, they may want to apply for Medicaid, but they have heard stories from people, out in the world that may say, "Hey, you own a home. You shouldn't do that." But that's one of the misconceptions. If you own a home, but you can't apply for Medicaid, some people feel like, "Oh, I own a car," or "I have a car." No, you can apply for Medicaid. I have a job. You can apply for Medicaid because Medicaid is based on your income and not the assets
that you have. We're joined today by Dr. Barnes from the Office of Student Health and Wellness. Welcome, Dr. Barnes.
Thank you.
I want you to start first by just telling us about yourself and a little bit about what does the Office of Student Health and Wellness actually do?
Okay. Thank you for having me, and I'm glad to be here. So I am the acting director in the Office of Student Health and Wellness for the Student Health Services Division, as well as the program manager for the Vision and Hearing Screening Program. And so within our office, we have several different programs that support students at Chicago Public Schools. We have our nurses. We have over 600 nurses within the OSHW family. We have the Public Health Division, which is where the Children and Families Benefits Unit support families and allow them to apply for Medicaid and SNAP benefits. And so our program offers vision and dental exams for students, as well as vision and hearing screenings. And if our students need a medical home, we actually have 32 school-based health centers within the Chicago Public School buildings.
Oh my gosh, you have just given a mouthful. We're going to have to unpack that almost one by one. So let's start with just when families hear the term kind of Medicaid or, they hear SNAP. What does that mean? And they may not fully understand. So talk a little bit about how the district provides outreach efforts to families and how families can better understand what those terms actually mean.
Absolutely. So our department under OSHW, we have the Children and Family Benefits Unit, and it's better known as CFBU. Those are the acronyms.
Okay.
That department actually assists families in applying for Medicaid. So Medicaid is a state and federally funded program where we assist families with applying for Medicaid. So our whole goal in OSHW is to make sure our students have a healthy experience in school. Mm-hmm. They have a medical home.
Okay.
And
that's so important, especially at a young age, because they get sick. And so a lot of times families need to know where to go. And sometimes those bills can be kind of high. So I think that's where the Medicaid comes in, right?
Absolutely. Absolutely. So we have our CFBU coordinators in all the networks.
What's a CFBU coordinator? We got to tell families what's going on.
Yes. So these are the people who are going to help our families actually apply for Medicaid. They screen them, they walk them through the process, they ask all the questions to help them feel comfortable. It is a very hands-on approach.
I love that.
And so families can feel comfortable, just trying to figure out if they qualify. And then sometimes families may feel like they don't want to apply for it, but their children can qualify for it. So it doesn't have to just be like the parents. It can be just for children as well.
Great.
And that's something that our CFBU coordinators are here for. They're here to help our families get enrolled.
Where does that process start, like in enrollment? Because we've just kicked off our pre-K application for next year, and families are about to get offers soon. So where does this kind of figuring out the right medical supports that they need, where does that happen within the school year?
So they can start at any point. Our CFBU coordinators are available throughout the whole school year, as well as in the summers if they need to, get enrolled. If they go to any school, any Chicago public school, they can ask the administrative team for hey, I want to apply for Medicaid. Like, how can I do that? I heard something about it. The other way, you don't have to go to a school. We have our hotline. So we have our OSHW hotline where they can call. We call it our Healthy CPS hotline. And that number is 773-553 KIDS.
Oh, I love it. Say it one more time. That's a quick and catchy.
Yes, 773-553-KIDS, KIDS. So families can call that hotline and say, hey, like, I heard something about Medicaid. I heard something about, my child needs immunizations.
Yes.
Where can I get it? How can I get it? How can I get them a healthy experience or a health home?
I love it. And then you talked a little bit about an application and, a lot of information. And so, what do families need to know about qualifying for these support services? And should anybody apply, or is it restrictions on who should apply? Can you talk a little bit about that?
Sure, absolutely. So if families are interested in just kind of getting a pre-screen or a preview for themselves, they can actually go to the www.abe website and to see if they actually qualify, or there are some things there that say, like, this is what you may be available, what may be available, or what you need to qualify. So it's abe.illinois.gov, and that's the website that they would go to in order to figure out, like, is some screening questions there. But if they don't go to that website, they can call that number again, 773-553-KIDS, and our CFBU coordinators can go through the process with them. They can actually help them and ask screening questions.
And for my families out there who may not know what Medicaid is all about, can you give me like a 1-minute elevator pitch?
Sure, absolutely. So Medicaid is a program, like I said, it actually is funded through the state and federal government, and it's for families with a certain income. So it's based off of income, and that's how families qualify. It gives them health insurance, basically. Families can take their children, they can take themselves if they need Medicaid for, like, vision exams, dental exams, and just, this is a health option for them, healthcare option.
And I love it because we all know entering school, there's certain things you have to have, right? Immunizations is one of them. You got to have a physical. You got to have a dental. There's vision and hearing screenings that happen. Talk a little bit about that and how your office supports that process and those opportunities for students to have that done right at the school.
Absolutely.
They don't have to go anywhere.
Right at the school. So within the Office of OSHW, we have vision and dental exam providers that will come out to the school and provide those exams for students. And that's the whole process and program. It does require a consent form from families. And as you know, there's a requirement date. So there's a date that students need to have their vision exams to enter into kindergarten, and that date is October 15th. They have to have their immunizations also by October 15th.
To enter into pre-K and kindergarten.
Yeah. Okay. And so, as a parent, myself, we're running around figuring out, like, my kid needs a eye exam, or my child needs to get their immunizations so that they can get enrolled in pre-K or kindergarten. Like I said, we have medical homes right inside of 32 of our schools. So 32 school-based health centers, as well as we have mobile van.
I was going to see if you were going to mention the mobile health services. Let me tell you, and I think I visited the health clinic in NTA.
Okay.
Oh my gosh. I mean, you forget that you're in a public school, and it's like you walk in and it's so clean and it's certified staff there, and it's amazing. And I know, as a mom, that time sneaks up on you, right? You think, I'll make my appointment. It's just they're getting out of school. I'll make my appointment, and then things, days turns into weeks, turns into months, and then it's time to go back to school in August, and then you're like, I got to get an appointment. But when you call, it's like 3 months out. You can't get in right away. So families, I need you to prioritize, start thinking about your appointments now. Health forms or screenings are good for a year. So you don't necessarily have to wait until like August to get it in. You can do it in July. So I would encourage you now to like find the right time and space for you to go and get that done and visit one of the health centers in our schools.
Absolutely. And so we're partnered with like UI Health.
Yeah.
We're partnered with the Rush. And those are the providers that are inside of some of our schools.
I love it.
And Lurie's Children, they bring the mobile health clinic vans out to the schools as well. And if your student needs a vision exam, like I said, we're partnered with the Illinois Eye Institute. So if, just say you need it over the summer, you can actually call the Illinois Eye Institute, let them know that your student is enrolling in Chicago Public Schools, and they will actually give you an appointment, and you can take your kid there and get their vision exam. Their vision exam, yeah. The vision screening, and so this is sometimes where families, we have a vision screening program that's the Illinois Department of Public Health. It's a requirement, a mandate. So the vision and hearing screening is different from the vision exam. The vision exam is a comprehensive eye exam that the students must have. So the vision screening does not, it's not what's needed for the pre-K and kindergarten. They need the actual full optometry exam from the ophthalmologist or optometrist. And sometimes parents get that mixed up, so they call our office all the time.
I was going to talk about misconceptions, so I'm glad you're clearing that up for families. Mm-hmm. So you mentioned that there's a mobile clinic, and I understand that that goes to different spaces throughout the city. But I know families may have questions about the actual centers that are inside of select elementary schools across the city. Can you talk about a little bit about how they know when doctors are available and if they have to go to that actual school? Like I went to visit the center at NTA. So if my daughter doesn't go to NTA, like would she still be able to visit that Center for Health Services?
Absolutely, yes. So NTA is one of our school-based health centers. And if you are, like, say your school is down the street from NTA, you absolutely can go into the school and say, hey, I know that you have a health center here, a school-based health center, and my student is a Chicago Public School student. And the families can go as well, like not just for students. If they have Medicaid or they have insurance, they're able to go and, you know, that's what our school-based health centers are for. They're for the school, but also some of them they have access to the community. And we want to make sure that our communities have equitable health care and health homes. So if you're in that community, you absolutely can go there. Or if you're not and you're just passing by like, hey, I see that there's a school-based health center there, you can absolutely stop by. We do encourage you to make an appointment. Make an appointment, or go in and make an appointment, see who's available. So providers are there at specific times, and the people will be more than happy to help you get an appointment for your student.
Now, is there a website or list, or is there, you know, sometimes when you go to, I'm just going to say Walmart and I'm not plugging Walmart, but I'm just saying, like when you go to Walmart, sometimes they'll say doctors are, on this day or that day, or the doctor comes in at 2:00. You know, is there a way for families to know what specific times doctors are available?
So each school-based health center has their own schedule, because they are run by other, you know, their individual providers. So what I could encourage is to call that Healthy Schools, Healthy Hotline, the 773 number, 773-553-KIDS, and you can just ask, like, hey, I live at wherever you live, and say, is there a school-based health center near me? Okay. You can also go to the cps.edu website and just type in health centers in schools, or I need a physical, or I need immunizations. And we have all of the 32 school-based health centers that are listed with the address. You can click on it, you can call the number and make an appointment.
All right, I know we started talking about some misconceptions, right? And you started giving one around vision screening, vision exam. What other misconceptions that families may have, specifically about applying for benefits or anything that you've seen in your work?
So, some of the misconceptions that families have, they may want to apply for Medicaid, but they have heard stories from people, out in the world that may say, "Hey, you own a home. You shouldn't do that." But that's one of the misconceptions. If you own a home, but you can't apply for Medicaid, some people feel like, "Oh, I own a car," or "I have a car." No, you can apply for Medicaid. I have a job. You can apply for Medicaid because Medicaid is based on your income and not the assets that
Assets
you.
that you have. That's
Yes.
great for families. Do you encounter, or maybe your team, families feeling a little bit nervous or feeling like there's some judgment that comes with applying for benefits?
Absolutely. All the time, we have families who are a little bit shy to apply and they don't feel like they want to share the story of needing help. And I will say that our CFBU team is very knowledgeable, very helpful. Um, there's a private conversation that you have with the CFBU
News. So your information is kept in a very private space. You're not out there, sharing. So we understand that this is your business.
Yes.
We take the time to make sure like you feel comfortable enough to share. But we hold your hand and walk you through the screening process for applying. I think that's important for families to know. I know that families that deal with schools know that their records and things are confidential. But sometimes something like this, there may be that wondering. So I'm glad you cleared that up. We talked a little bit about Medicaid and the purpose of the importance of establishing a medical home and the opportunities for families to get access to medical services, whether that was uh, hearing and vision or health services for immunizations at the health clinics that are across elementary schools. But I think, there are some other services that your office kind of supports families with. Can you talk a little bit about a little bit of kind of work you do and kind of other areas that you support? Absolutely. So families can also apply for SNAP benefits, supplemental nutrition assistance program, which helps parents get food, helps to put food on the table. That's something that families can apply for. We help families get SNAP benefits as well. So that's one of our.
I don't think that's really uh, publicized, right? I think families think I have to go to this whole other place. And I think one thing I love about what you're saying is that you don't have to go anywhere. You can go right to your neighborhood school and get the medical, get the food, and get all of the services that you need to ensure that your child is ready and for school, but also healthy, right?
Yeah.
And yeah.
Yeah. So if you need or want to apply for either Medicaid or for SNAP benefits, again, our CFU coordinators are there to help you walk through the process. They will meet you at your school if they need to, or if you want to do it over the phone or go to one of the network sites. We do have offices where you go in and it may not be their school, but it may be their network site where you can go and actually speak to someone in person or just speak over the phone. It's totally up to the family how comfortable they feel about doing that. But in any school you go into, we have our literature there. So, say for example, you go in, you don't want to talk to anybody about it. There's literature there that says how to apply for it or enroll yourself or your kids in Medicaid and SNAP. It's we have flyers off in that school.
I'm so glad that you said that because I know there's some families out there that may be hearing this for the first time and they might say, like, well, I just want to learn a little bit more. So go into your neighborhood school, pick up a flyer, get the information that you need. And when you feel comfortable, you can call. What's the number?
773-553 kids. This is call that number, but you also can visit the website absolutely to get more information. So I think, we've shared a lot of information that I know that's going to help families. School will be ending in June. And so, I think as families start to think about next year and think about all the medical compliance that has to be in place by October 15th. And I think what you're sharing today is so helpful. So let's talk about that October 15th date because it comes a lot quicker than most folks think. So October 15th, what needs to happen by October 15th? So students who are enrolling in pre-K or kindergarten or new to the school district have to have they need to be up to date with their immunization. And this is not my rule. No, this is the state of Illinois. That's right. This is the state of Illinois rule for students to be enrolled in Chicago public schools. Yeah. So that October 15th date, we do everything within our OSHW program to assist. We call families. We say, hey, we let you know, like if your student is missing an immunization as well. So we have a whole group of health professionals that are calling and saying, hey, they might be missing a dental exam. They might be missing their physical. So we have a team that's calling families to let them know we want to help you get to that October 15th date.
I love it. And I think one thing families need to know is there's this packet of information that comes home with children or students every school year, at the beginning of the year. Yes. And in that packet of information, there are the consents, because we talked about that in order to access this, you need to have parent consent. And so all of the consents that are needed is nicely packaged. Yes. Is that folder or packet of information that you get when you register for pre-K or kindergarten or new to the district. You'll also get it at Family Night at the beginning of the year. So they're gonna make every effort to make sure you get those packets. And I'm gonna tell you, my daughter worried me to death about completing that packet. And so, so just so families, that packet is coming home and the kids are going to be on you about completing that packet. Please complete that packet so that your child can be in compliance by the October 15th. Okay, so we've been talking about that October 15th date and why that's so important to make sure a couple things. One, that children are screened early and that they have what they need in order to meet medical compliance. And that's important for a couple of reasons. One, we know that a child who can't see cannot read. And we know that children who are hungry cannot learn properly. But talk about the importance of that deadline and how it can relieve burdens from families because, one, they access the services to get the Medicaid, but maybe when they go to the screening, something may come up. Talk a little bit about how that deadline also helps families to feel like they can get what they need for their child.
Absolutely. So if a family takes their students to get their vision exam or even their dental exams, and I do want to just say the dental exam deadline, a little bit more time, which goes to May 15th. So for those families that need to get the dental exam, they have a little more to have a little bit more time. But the October 15th deadline is very important for the vision exam as well as the immunizations. Okay. So say your student comes back or your child comes back and the optometrist says, hey, I think I see something and maybe, their student might need glasses. Right. This is where those Medicaid benefits really kick in, like, because glasses can be expensive and we have providers that make glasses on site. So, they'll do the fitting for the students. They have the Medicaid already as a benefit or for their health insurance. And so that's covered. That's covered under Medicaid. You don't have to worry about that cost because you have the benefit already in place. And our students are getting ready. We always talk about they have like their backpacks, their cute little backpacks and getting ready for school, but they need those classes too to help them learn and be academically ready as well.
Yes. I think we all can understand the importance of just making sure the basics are in play for children to be successful in school. So we have shared a lot of information. So I want to thank you for just being a wealth of knowledge and really sharing information that families need to know as they're thinking about preparing for school in the fall. But we're not done. I have one of my favorite games that I love to play. It's called Red Light, Green Light. Have you played that as a child?
I have.
Okay.
Well, yeah.
All right. So, on this show, it's all about, making sure families have the right information and making sure that we're demystifying things for families. And so part of Red Light, Green Light is I'm going to ask you some questions. You'll get your paddles. And red will be if this is just absolutely not true. Yellow, it's could be true, but let me explain. And green is yes. Wholeheartedly, I could stand behind this. All right.
Okay.
So we're gonna get ready to play. I'm gonna try and trick you. I'm gonna ask a couple questions. Families should avoid applying for benefits unless they're absolutely sure that they qualify. Tell me why.
Because families, you may not know if you qualify or not. Our CFBU coordinators, children and family benefits unit coordinators will do a screening for you. So families should try. Call that number 773-553-KIDS. Call that hotline number and ask. You don't know if you qualify or not. Give it a shot.
I think that's important because so often things change so often and we just don't know. And so I love that you are encouraging all families to apply for Medicaid and apply for your child because there's no certainty that you may not qualify, right? So there's opportunity for families and the benefits outweigh, the doubt. Okay, so next question. Young children benefit from having a stable health home.
Absolutely. Sound why. So students, if they have a stable health home, first of all, they are building those relationships in that with those pediatricians, right? And those healthcare professionals in those health environments.
Yeah.
And so they get to know the students, they get to know which organizations they have already had, their schedule. If something's wrong, we like to encourage child visits too. So just, making sure that we know in our communities that being healthy is a good thing. Go and get your eyes checked every year, or as often as you feel like you need to, and not just when something is wrong. So that's how we start out very, very early with making sure our students have a health home. And that provides them like a safe space where they go for they need behavioral health, if they need the immunizations that we talked about, the vision, the dental. I remember my son coming back, at school and he said, "Hey, I got my teeth cleaned today." Like at school, he was so excited about it. And so I think that having those relationships inside the school and then with the, friends later.
And isn't that so scary, right? Because sometimes when you're young and you go to the dentist, you're walking in this room, you see this big chair, you're not like, what? But we used to make it in pre-K. When I was a teacher, we used to make it so much fun when they used to come in and do those screenings. We did them right in the classroom. It was stress-free. And what I always used to tell my families, if you stay ready, you don't have to get ready. Absolutely right. It's preventative, right? So we want to make sure we do those checks. All right, last question. Access to consistent health care can positively impact a child's school readiness.
Absolutely. Students, when they have, we concentrate on the whole child aspect of their academic readiness, and just helping them prepare for school. And they have the health parts, where they need with their health and their academic success. So,
all right. Well, I feel like we have provided so much information, but if families want more, I'm going to give you one last opportunity to tell them where they can go to get information that we shared today.
Absolutely. So you can call the OSHW's Healthy Hotline, Healthy CPS Hotline. And that number is at 773-553-KIDS. So 773-553-KIDS, KIDS. If you can't remember that one, then you can always go to the CPS website and just type in whatever you need, and we pop up in the information that you need.
Great. So I would not be a good former teacher or district leader if I did not give families homework.
All right. So I'm going to give my families a reminder and I'm going to give them homework. But I do want you to give them an action item. What do you want that based off of everything we shared today? What do you want families to do? I would like for families to just go take a look at the CPS.edu website and type in OSHW, type in Medicaid, type in SNAP. Look and see, like, you know what? Let me give them a call. Let me just see if I qualify or if my student qualifies. So I would definitely encourage families search us up, and give it a try.
I love that. And I think it kind of goes right along with what my reminder is for families. And I think what you're telling me is just take a risk, look and see what access is out there. And so my reminder for families is that needing support does not mean that you're failing. Absolutely not. Sometimes we feel like it's so hard to ask for help. And I really want to remind my families that it's okay. And it doesn't mean anything negative, or it doesn't reflect poorly on you as a parent or on your family in general. All right. And so my homework, families, my homework for you is to learn about at least one resource that was shared here today. And so, families, I'm closing by saying if this episode touched your heart, if this episode gave you a little bit more information about how the district supports a healthy child and how they work together to provide the right resources so all children can be successful in learning school, please share, please subscribe, and please comment below that if this was helpful information for you. And we will see you next time in the circle.